Okay guys, very good evening. As I promised you that second part will complete today. So this is half an hour session. The remaining MCQs of psychiatry will complete today. And again I request you that please try to share if any opinion you have, any MCQs which if you have appeared in this previous exam. If you remember, if you are able to recall any MCQ, please share now so we can discuss. One MCQ they have asked, always they target this area. The patient after getting operated for appendicitis developed confusion and hallucination. His wife informed that he takes alcohol occasionally. What could be the most probable cause for his condition? So see, alcohol, examiner tried to confuse you. Alcohol hallucination can't be the answer because we have alcoholic hallucination when we have a person is alcohol dependent. So in MCQ it's clearly mentioned that patient takes alcohol occasionally. So it can't be the answer. Okay. Acute and transient psychotic disorder, there will be hallucination is there, but person having a confusion, no other symptoms. There are so many symptoms will be in acute and transient psychosis. Patient can have a hallucination, delusion, patient will have muttering to self, patient will have a sleep disturbance, some anger outburst, maybe aggressive behavior. So there are many other symptoms which are not given in this MCQ. So acute and transient psychotic disorder also ruled out. Mania, there is not a single symptom of mania is given in this MCQ. Mania, we have, patient will have more talkativeness or elated mood, increased energy, decreased need for sleep, increase in goal directed activity, irritability, okay, increase in pleasurable activity. So mania also ruled out. So guys, as I always used to tell in classes, and again I'm telling you today, that have a good concept of the topic. Once you see, as always I try to reinforce on this point, that whenever you read the MCQ, as you go through the options, if you have a confusion in topic, always you will have a problem in two options. Once you are clear with the you have a clear thought process about the topic, then you will never have a confusion. You directly go for the right option. So alcoholic hallucinosis or can't be the answer because patient takes alcohol occasionally. Acute and transient psychotic disorder can't be the answer because the symptoms are not sufficient to fulfill this criteria, and we will not have a confusion in the acute and transient psychotic disorder. This is another hint. Mania, not a single symptom of mania is given here, so it can't be the mania. So answer will be delirium. Delirium, guys, again and again they are asking. So delirium will try to discuss. I will tell you properly delirium, what MCQs they can ask about the delirium. In delirium, they have number one, it's a most common organic disorder. It's a most common organic disorder. Number two, how we diagnose the delirium. Diagnosis of delirium. Diagnosis, because delirium again and again they are asking, so I will discuss in a little detail. The first criteria, patient will have impairment or clouding of consciousness. Patient having an impairment or clouding of consciousness. Because of that, patient having a disorientation to time, place and person. So impairment or clouding of consciousness, disorientation to time, place and person, and because of that patient will have memory deficit. Memory deficit. Patient will have immediate and recent memory deficit, remote memory will remain intact. Remote memory will remain intact. Okay. Apart from that, patient will have perceptual abnormalities. Perceptual abnormalities. Perceptual abnormalities in the form of illusion and visual hallucination. Illusion and visual hallucination. Okay. Apart from that, patient will have transient or fragmentary delusion. Why transient or fragmentary delusion? Patient, the cardinal feature, the main feature of delirium is what? Impairment of consciousness. Because of impairment of consciousness, patient delusion comes, goes, comes, goes. This is the transient or fragmentary delusion. Transient or fragmentary delusion. So transient or fragmentary delusion seen in delirium. Transient or fragmentary delusion seen in delirium. Patient will talk about delusion, second minute will forget about it, then the delusion comes, goes. So transient and fragmentary delusion seen in delirium. Patient will have sleep cycle disturbance, sundowning phenomenon. What is sundowning phenomenon? Sundowning phenomenon, as the sun sets, as the sun downs, patient condition get worsen. So in morning and afternoon, delirium patient will remain better, but as the evening comes, the patient will have worsening of the symptom. We call it a sundowning phenomenon. Okay, and patient will have increased psychomotor activity. Patient has increased psychomotor activity. So these are the important diagnostic criteria of delirium. Okay, in delirium, guys, another important thing they ask, that confusion assessment method we use. Confusion assessment method we use. Okay, confusion assessment method we use to assess the delirium. If you will go in etiology, we have a intracranial etiology and we have a extracranial etiology. In intracranial etiology, we have a infection like meningitis, HIV, encephalopathy. We have a vascular events like subdural hemorrhage, thrombosis. We have epilepsy, endocrine, tumor, some endocrine region. These are intracranial. Extracranial are also infection like septicemia, metabolic abnormalities like serum electrolyte imbalance, one of the common cause of delirium, hypernatremia, renal and liver failure. We have a hypoxia like situation, respiratory and cardiac failure, and alcohol and various drugs like centrally anticholinergic drugs like beta blockers like isoniazid. These are the drugs which are prone to cause delirium. If they ask you that what is EEG finding, electroencephalogram finding, in all delirium patient we have slow wave EEG. All delirium patient we have a slow wave EEG except alcohol withdrawal delirium and benzodiazepine withdrawal delirium. So alcohol and benzodiazepine withdrawal delirium, both delirium have fast wave activity. Both delirium have fast wave activity. So all other delirium have slow wave activity except alcohol and benzodiazepine withdrawal delirium. If examiner asks you about the treatment, in treatment guys, in treatment we have usually the many students say benzodiazepines. No, please remember benzodiazepines are contraindicated because one of the side effect of benzodiazepine is what? Cognitive deficit. Delirium is a organic or cognitive disorder, so if you give benzodiazepine, the patient condition will worsen. That's why please remember forever that benzodiazepines, before in emergency condition, before giving benzodiazepine, always try to rule out the delirium. Then what's the treatment of delirium? So benzodiazepines are contraindicated except alcohol withdrawal delirium and benzodiazepine withdrawal delirium. In both delirium, the drug of choice is long-acting benzodiazepines. The drug of choice is long-acting benzodiazepines. Okay, long-acting benzodiazepines. Then what's the treatment of delirium? Treat etiology. Treat long-acting benzodiazepines like chlordiazepoxide and diazepam. What's the treatment of delirium? Treat the etiology. Whatever the cause, electrolyte imbalance, any hypoxia, any liver problem, renal problem, you target the cause. You try to target the cause. We give low dose of haloperidol, okay, low dose of haloperidol. Why we give? To decrease psychomotor activity. Okay, but treatment of delirium, so 3 lines. Treatment of delirium is treat the cause, low dose of haloperidol to decrease psychomotor activity, and benzodiazepines are contraindicated except these two, alcohol and benzodiazepine withdrawal delirium. Correct guys? Apart from that, so this is about the delirium. You have to delirium, that's why I discussed little in detail because it's a very important topic. Again and again they are asking. So in this MCQ, the answer will be delirium. Okay, the one MCQ was a child with normal learning skills but having a poor mathematical skills. His IQ is appropriate to his age. He passed the exam with poor mark. What could be the probable cause? See, patient having a normal learning skill, IQ is fine. Patient having a poor mathematical skills. So exam phobia can't be reason of poor math. So patient can have a skills is fine while patient giving the exam, or if facing maybe he's having exam phobia, that's another thing. But mathematical skills should not be the reason. So if poor mathematical skills can't be due to exam phobia. Okay. ADHD, in ADHD we will have other symptoms, other symptoms like inattention, hyperactivity, impulsivity. Okay, so no other symptoms has been given about ADHD. Asperger syndrome, it's a autistic spectrum disorder. In Asperger syndrome, it's a, like nowadays previously we were calling it a pervasive developmental disorder. Now we call it a autistic spectrum disorder. In autistic spectrum disorder, one of the autistic spectrum disorder which we divide nowadays on a severity basis, we have Asperger syndrome. But in Asperger syndrome, patient should have the impairment of the social interaction, stereotype behavior. These symptoms are not here. So answer will be what? Specific learning disorder. So in this question guys, answer will be C for Calcutta. Okay, in specific learning disorder, why we are talking a lot about the specific learning disorder? So in specific learning disorder, in layman term we call it a dyscalculia. Lexia, we call it a dyslexia. Okay. Tare Jami Pe, I hope you remember the movie of Amir Khan, the specific learning disorder. They try to, talk about this, emphasize on this topic. Specific learning disorder we have of reading, we have writing, we have mathematical skills, and we have mixed. So reading, writing, mathematical skills, and mixed. So child will have a problem of reading. Instead of U, he will read V. Instead of W, he will read M. Writing, same thing. Instead of V, he will write U. Instead of W, he will write M. Mathematical plus minus. Okay. And we have mixed, reading, writing, and mathematical skills together, mixed. Okay. For making a diagnosis of a specific learning disorder, IQ should be normal. Without IQ, we can't make a diagnosis of specific learning disorder. If IQ is an issue, then it is not due to specific learning disorder, it is due to problem in IQ. Okay, so the child has limitation. So before making a diagnosis of specific learning disorder, the IQ should be checked, and the IQ should be normal. Apart from that, the history of migration, history of migration we have to rule out, because in this, suppose child live in one state or in one country, and then he shift to another place, because of language barrier, then can be issue. So other things you have to rule out, but the important one, the IQ should be normal. So if IQ is normal, then we call it a specific learning. We can make a diagnosis of specific learning disorder. So child psychiatry nowadays they are asking. So this another question has been asked. Okay. The another MCQ they have asked, guys, they asked a patient having unilateral headache associated with nausea and vomiting, which drug can be used to decrease his headache episode? So we have unilateral headache associated with nausea and vomiting, which drug can be used to decrease a headache episode? So yes, the answer in what is the diagnosis in this MCQ? The diagnosis is what? Migraine. So the person having a migraine in this MCQ, migraine. Okay, so in migraine, how migraine? It's a female dominant, it's a unilateral, start from unilateral, followed by it occur in a whole head. So usually we say it's a unilateral, it starts from one side, but always it's a then involves the both side. Okay, it's always associated with nausea, vomiting, photophobia. Okay, phonophobia. Okay, so associated with nausea, vomiting, photophobia, phonophobia. Okay, always precipitated by sunlight. Okay, and apart from that, traveling, if the patient travels, sunlight, traveling, and patient having a lack of sleep, and even remaining without food, so hunger. So if the patient hungry for long time, travel, lack of sleep, sunlight, even sometimes these various sources also can precipitate migraine. That's very important. Okay, so it's a always person will have a unilateral, then involves the both. It's a pulsating type, that also you have to remember. It's a pulsating type associated with nausea, vomiting, photophobia, phonophobia, precipitated by sunlight, traveling, lack of sleep, hunger, various sources. Okay, we have a treatment in migraine. We have for acute, and we have a prophylaxis. So in acute, we have a treatment is to acute, to abort the attack, to abort the attack, to abort the attack. In abort the attack, what we do? We use the either NSAIDs, or we use the triptan group, sumatriptan, triptan group, correct. 5-HT 1B 1D agonist, 5-HT 1B 1D agonist. So we use triptan group, sumatriptan. Nowadays we have a razotriptan, and NSAIDs we use. And sometime the patient will say कि sir, nowadays I even have to take a injections, उसके बिना काम नहीं चलता. Okay, and if in a prophylaxis, yes, we use beta blocker, propranolol. Okay, then we started using sodium valproate, and nowadays it's almost like a drug of choice, topiramate. So beta blocker, propranolol, sodium valproate, topiramate. Topiramate nowadays we use. It's almost like a drug of choice for the migraine treatment. Okay, so in prophylaxis we use beta blocker, sodium valproate, and currently topiramate. To abort the acute attack, we use NSAIDs, particularly we use triptans. The mechanism is 5-HT 1B 1D agonist. Okay, this is about the migraine. Okay guys, so this MCQ they have asked this time. Okay, MCQ 1 was what I have till now with me. It's a like recalled MCQ collected from the various students. The first MCQ was a student having IQ level 55, having difficulty in studies, belong to which of the following category? Yesterday we discussed it. Mild mental retardation. Okay. Number 2, a person with anxiety has a feeling that his parents will die one day and he will have sleepless night. Which of the following disorder describe his condition? Answer was generalized anxiety disorder. A child with normal learning skills, with poor mathematical skills, IQ is appropriate to his age, he passed the exam with poor marks. What could be the probable diagnosis? Specific learning disorder. And a patient with 6 episodes of depression, hypomania, mania in a year with recovery phase in between. Which of the following is an appropriate diagnosis? Okay, the answer is rapid cycling bipolar disorder. In rapid cycling bipolar disorder, we have at least 4 different episodes in last 1 year. 4 different episodes in last 1 year. We call it a rapid cycling bipolar disorder. So we have a bipolar disorder type 1 episode of depression, 1 episode of mania. Recurrent mania also comes under bipolar disorder type 1. Then we have a bipolar disorder type 2, at least 1 episode of depression, 1 episode of hypomania, and we have a rapid cycling bipolar disorder. Chromosome 18 and 22 are associated with bipolar disorder. Patient, after getting operated for appendicitis, developed confusion and hallucination. His wife informed that he takes alcohol occasionally. What could be the most probable cause of this condition? And answer will be delirium. answer will be delirium, guys. Okay, and we have a patient having unilateral headache associated with nausea and vomiting. Which drug can be used to decrease his headache episode? And answer will be propranolol. Apart from propranolol, in prophylaxis we use valproate and topiramate. In acute attack we use the triptans, sumatriptan, razotriptan, and we also use NSAIDs sometime. Okay, so these were the MCQ till now what I was able to collect, but I request you, if you have any other MCQs, please share with me. I can share my number also with you. If you have any other queries also, psychiatry related or any mental health problems, any issues, please try to share with me. I will be more than happy to help you out. Okay, guys, correct? This is my personal number. Please try to share MCQs, any other queries, okay, any other issues, if I can help you out. Okay, you can join also on Unacademy. It's an amazing platform. You already have, you took the classes. Many students are giving really good feedback. You are sitting at your home and you are taking classes. No need to go anywhere. Just the lecture, the various educator are reaching to your house, your room, and they are teaching you nicely. With the good, the software is really amazing. I don't know, since I am taking classes, it's really very smooth and everything is fine. And yeah, faculties are also amazing. So you can have a mama's food and take a classes in your room. Okay, if you want to use my code, it's a DSync10. Okay, guys, these various subjects you will get. Psychiatry, you will get 20 hours. Apart from that also we have, various subjects. You will see the hours are really very good. Medicine even 108 hours, and surgery also 90, and obs, gynae and anatomy you can. So if you want to join, you can join it as soon as possible. So these 2 sessions I have taken for the FMGE recall in 2020 December. But I request you, if you have any other queries or MCQ, please try to share with me. And for the students who are preparing now, please restart. Even some students were unfortunate, they were like between 140 to 150. I request you, don't feel disheartened, don't waste so much time. Again you will waste 1 or 2 months. Again you will forget everything, and then again you will restart. Again you will on a same 0 point. So please, now I understand it's a difficult time, but just 1 or 2 days, take your time, analyze your mistakes, where you have done where you have gone wrong, and again have a good. Only again I'm saying, FMG is also nowadays it's like properly very difficult questions they are asking. So have a good concept of the topic and subject. Even some topics are left out, no issue, but whatever you read nicely with good concept. So good faculty will make a difference in your preparation. So take a classes, do the MCQs, give the paper more and more, and definitely in next exam you will shine. Okay, guys, so thank you so much. Best of luck. Be in touch. Tomorrow again with 7 p.m. with the INSCT MCQ I will appear in front of you. Okay, so bye bye, take care, have a nice Sunday evening.